One of the most common cases I see in the clinic is headache cases, headaches that occur around the eye. However, we chose this topic because most of these cases don't have a treatment in my ophthalmology clinic. So why do they come to the ophthalmology clinic? Because the pain occurs in the eye. That's number one. Two, it is accompanied by blurred vision. And this is what we will walk through together during this episode. You'll find a lot of surprises. It might start with something very simple, and it could be something very serious. For instance, one of the causes of headaches is dry eyes. Spending a lot of time on smart devices, whether for a young child or an adult, causes dryness, irritates the nerves, and consequently leads to headaches. At the same time, it could manifest as very, very severe pain on one side, leading to a desire to vomit and many other things we will talk about. We might be surprised to find that the patient, God forbid, has a brain tumor which could be life-threatening. So headaches are a major topic that we need to discuss because they must be taken seriously. I will be with you, Dr. Mohamed Hantira, Assistant Professor at Al Qura University and Medical Director of Ain Al Hikmah Clinics in Jeddah, Kingdom of Saudi Arabia. Stay with us. As for the second group, this is the most common thing I see in the clinic, and the most famous of them is tension-type headache, which is stress-related. Some people listening to me might think stress means working long hours. Of course, sitting for long periods in front of devices plays a role. This makes a person strain their focus. But it could also be psychological stress. And sitting for long periods might make you forget to eat. So hunger can be a cause of this type of headache. Thirst can cause dehydration, which we call jafaf, and that also leads to headaches. Long-term exposure to light, whether from a tablet, iPad, laptop, or television, or if I am working on multiple screens, for example. All of this causes eye strain, so you find the patient getting a headache. The headache occurs most often in this area. But here, a good doctor asks the patient, can simple things in the day cause the headache to appear? For example, you go to comb your hair and get a headache. You go into a swimming pool and get a headache. You eat a certain food, you get a headache. Is it related to the menstrual cycle causing a headache? No, none of these things affect this type of headache. So the first type is tension type headache, or the one resulting from stress. The second most common one in this group is the migraine, or what we call a migraine headache. It's called a migraine because the most common form is that it affects one half, not the whole head. So you find it gripping the eye area and below it. This whole part is where the pain and the headache are. But here it is affected by a lot of things. Migraines are affected by light. They are affected by hormones, specifically changes near the menstrual cycle. Certain types of food, for example, preservatives in food, certain types of cheese, yellow cheese, corn, chocolate. All of these can cause migraines to occur, accompanied not just by pain, but also by ringing in the ears or light sensitivity that makes it impossible for a person to open their eyes, whether looking at a computer screen or even while driving at night. And the strange thing is that very simple things can trigger a migraine. For example, normal daily activities like eating, drinking, or simple exercise can trigger it immediately, and one might wake up from sleep in pain suddenly for no reason. But as I told you, it is accompanied by symptoms. Let's look at the last and most severe type in the second group, which we call cluster headache. I remember one of my relatives who used to get cluster headaches. He would tell me, I feel like I've been punched in the eye. Why in the eye? Because all the pain is concentrated in that area. It's such severe pain that he even feels the urge to vomit. And of course, due to the intensity of the pain, it's accompanied by the same symptoms as a migraine, such as sensitivity to light and ringing in the ears. And on top of that, there is also very, very intense sweating. So we finished the second group, for which no one knows the causes. We care very, very much about treating it with simple things in our daily lives. We will discuss together what to do to treat the second group. As we said, this second group consists of three types: tension type headache and migraine, which is the headache on one side. And finally, cluster headache. The most important thing for all of them is to stay away from things that might trigger the headache. For example, very bright light increases migraines. Eating chocolate also increases migraines. We go towards painkillers, take magnesium, we try to have consistent sleep periods every day. All these things make the brain calm down. So the electrical impulses working inside the brain calm down, and consequently, the headache decreases. We need rest. Stress from work and psychological stress. We must give it a rest. Travel, prepare something. Watch a movie, change the atmosphere. This is very important. We will summarize it with the word SNOOP. S-N-O-O-P. The S is when the patient tells you, I've lost weight this past month along with the headache. I lost a lot of weight. Or I started running a fever. But I don't know the cause of what. I went and did tests for fever of unknown origin. This is something that worries us a lot. What is it that they don't have? No bladder infections. No, she doesn't have a throat problem. There's nothing. This worries us. The N is for neurological. The patient complains of seeing things double, that the pupil of the eye remains constricted or dilated, or that their face gets flushed, or that they have trouble when they go to comb their hair. They aren't able to raise their hand to comb it, or they were able to climb stairs, but now they can't. So there is a problem with their muscles. This is a point we shouldn't overlook, neurological. The O, the onset that comes suddenly. That is very dangerous. If you used to get headaches, with every cycle, if you were used to getting headaches, that's not a problem. But if it's sudden, no, let's focus on that very carefully. The P, which is the pattern, if it happens that the headache was worse today than it was yesterday. And today is worse than yesterday and the day before. This progressive increase, this worries me a lot and makes me want to involve my colleague, the neurologist in this case, to get their opinion on the matter of headaches not accompanied by eye symptoms. There is no redness, nor is there any decrease in vision. This episode is the first in a discussion about a very important topic, as 50% of normal people experience headaches. We will delve into it more and dedicate episodes to it because it is an important topic, and in fact, there is little education about it on social media. Follow us in the upcoming episodes and write to us about what you would like us to talk about after the headache episodes.